hello, good evening, and welcome you all to the 110th episode of Business Bytes with Bhavana. So, today we have one of our member guests from who's into the industry of dentistry, right? Which is really important, right? Whenever we meet first person, what we are going to see is how they are, how well they smile, how well they interact with us. So this is one of the important streams might be that is needed. So let us all put our hands together to welcome Dr. Nishank Kande, who's a dental surgeon, to today's show. Hi Nishank, welcome to the show.
Hi, good evening, ma'am. Good evening, everyone. I'm very lucky to have the 110th episode with Bhavana, ma'am.
It is our pleasure to have you also, Nishank. So, uh,
Ma'am.
your dental surgeon. So, surgeon itself is kind of, the word. If we hear to it, we feel like, oh, surgeon na anipistundi. So, how did you make this choice of this course? How did you come into this industry?
Ma'am, previously have seen many patients roaming around dental clinics and
Hmm.
spending their lots of time for dental treatments and all these things. Then I got an idea that even if I go to this field, even I will get some identity and I can help the people and patients with my services. So I have choose this field. In this way, I have choose this dental and I came into this. And I'm working since 6 years, ma'am. I'm running my clinic since 6 years.
Okay, so 6 years you've been into this industry. So, along the experience in this
Yes,
six
ma'am.
years.
Nice, ma'am. Nice, ma'am. I have faced and uh, experienced many kind of experiences and many kind of. I have seen many kind of patients and with the different mentalities.
Hmm. Hmm.
Even I am getting good support from our group also.
Okay. Hmm. ఓకే. సో, ఈరోజు డెంటిస్ట్రీ గురించి మాట్లాడాలంటే వాట్ డు వి హావ్ సంథింగ్ హౌ ఈస్ ద ఇండస్ట్రీ డెవలపింగ్? లైక్ వి హావ్ లాట్ ఆఫ్ న్యూ థింగ్స్ కమింగ్ అప్ ఇన్ ద డెంటిస్ట్రీ యాస్ వెల్, రైట్?
Yes, ma'am.
So, would you like to share what are the recent developments that is in dental industry?
Medicine.
Yeah, in dentistry, what is the new advanced techniques that is in place in today's world? So, would you like to speak about like how is it trending in dentistry? What are the new solutions and more?
Yes, ma'am. Now, previously, while coming to root canals, ma'am, I will start by step.
Hmm.
Previously, in root canals, they used to do treatment in 3 stages. They used to call a patient first, and they used to give medication, and next they used to do access opening. Like that, they used to do in 5 steps. Now we got latest machinery and latest equipment in which we can do whole root canal treatment in single sitting, and even patient will get relief with single sitting in one within one within half an hour. He will get relief and he will be happy without any pain. Previously they used to call the patient for 5 times, and patient used to roam around the clinic for roaming for 4 to 5 times. He will feel sick and he'll get afraid to come to dental clinic. Now it's
Right.
all changed, ma'am. Now we are using latest equipments. uh, Here we are using endomotors. With the help of endomotor, we can do root canal treatment in a single day. I mean, single sitting. We can complete the case and we can insert the cap in second sitting itself.
Okay.
Now,
So you're telling the number of visits to the doctor has reduced, and in that way,
yes, yes,
everybody can
we have
avail.
decreased the.
Hmm, hmm.
Yes, ma'am. While coming to missing teeth, previously people used to take support of the side teeth and they used to build a crown like bridge like thing. Now we are using like implants without disturbing the side and abutment teeth. We can directly
Mhm.
place an implant into missing teeth, and we can build a new teeth in that place without disturbing the surrounding teeth.
Okay. Okay. Mm-hmm.
Now,
So,
in the
mm,
industry, everyone are doing with everyone are going with the implant technology. And when we go for gums, previously they used to do with hand. Now we are
okay.
using laser technology.
Hmm.
In laser technology, minimal blood loss. Patient will not lose his blood. Without any pain, he will cover. He will get cured with his disease.
Okay, so you mean to say that the pain and the process that someone used to undergo in the past, that has got reduced to a greater extent, and one can avail kind of the best
Yes, ma'am.
services. All right. So we have lot of audience who's
Yes, ma'am.
joined
Yes,
in
ma'am.
live.
Exactly.
So thank you so much for everyone who's joined in. A very good evening to everyone. Imadi Ramesh Garu, good evening everyone. Antunaru, very good evening, Andy. Durga Shanti Garu. Happy evening, Bhavana ji and Dr. Ji Antunaru. Happy evening, Andy. Sanjay.
Ma'am.
Hi, Bhavna and Dr. Nishank. Sanjay here, Antunaru. Yes, Sanjay. I think that this time it is not through
Hi.
groups, so we're able to see your name. So,
Yes,
good
ma'am.
evening, Bhavna
Yes,
Garu
ma'am.
and Dr. Nishank Antunaru. Vijay Kumar. Hi, Nishank Garu and Antunaru. Nishita Nandish. Hi, Bhavna Antunaru. Okay, there's a question coming up. Can you elaborate on invisible braces
Ma'am.
which is trending as well? Till what age do you suggest? Ani adugutunnaru.
Ma'am, invisible braces.
Hmm.
Even nowadays, invisible braces, you need not come to the clinic also. If you post your problem and if you give your measurement, we will come to your home and we will take your whole mouth measurements so that we can create a removable thing like that. So without coming to clinic and without wasting your time, you can correct your teeth. I mean, you can correct your spaces or irregularities with the help of that.
Okay.
Uh, when we come to age, all these type of treatment, it will be good and it will be suggestive up to 32 years. Post 32 years, it takes some time. It takes more time to get corrections.
Okay, okay. Till 32 years, it's easy and alignment would be
Yes, ma'am.
faster, Ani. He's saying.
It will be faster.
Okay. Okay, so this question is from one of the Facebook users. I hope
Yes.
that answers your question. Whoever has asked that. So Vinay Gupta Garu. Hello, Dr. Saab Antunaru.
Ma'am. Hi.
Kacham Ramu Garu. Hi, Bhavna Garu. Good evening. Hi, Nishank. Wish you good luck. With his nice treatment, we are
Thank you, Anna.
smiling with
Thank you.
heartfully అని చెప్తున్నారు. Thank you, Ramu Garu.
Thank you.
Good to know that you've availed services
Ma'am.
with our Dr. Nishank Anamata. So that's really nice. Srinivas Belly Day. Good evening, Antunaru. I came to know that in single sitting RC will be over అని చెప్తున్నారు అవునా?
Yes, sir. Yes, sir. Single sitting RC. Just now I spoke there. Spoke to ma'am. Sorry. సింగిల్ సిట్టింగ్ ఆర్సీ వచ్చేసి మనము ఎండోమోటర్తో చేస్తాం సార్ వితౌట్ ఎనీ పెయిన్ ప్రీవియస్ లాగా 3 సిట్టింగ్స్ 4 సిట్టింగ్స్ లేకుండా సింగిల్ సిట్టింగ్లో మనం ఇన్ఫెక్షన్ మొత్తం క్లీన్ చేసేసి కంప్లీట్ క్రౌన్ మెజర్మెంట్స్ తీసుకొని కంప్లీట్ చేసేస్తాం సార్ విత్ ఇన్ వన్ డే మీకు మొత్తం ట్రీట్మెంట్ కంప్లీట్ అయిపోతుంది 1 డే ఇన్ ది సెన్స్ విత్ ఇన్ హాఫ్ అన్ అవర్ మీకు ట్రీట్మెంట్ మొత్తం కంప్లీట్ అయిపోతుంది సార్ అండ్ సెకండ్
Okay.
సిట్టింగ్లో డైరెక్ట్ క్యాప్ ఇన్సర్ట్ చేయడం అంతే.
Hmm. So there's a lot of advanced treatments also in dentistry. So any kind of problems anybody has, do not hesitate. You all could definitely reach out to our Dr. Nishank Kanamata. His number is in the scrolling bar. It's 9030666189. It's 9030666189. Anytime you have any kind of problem, you could he's just a call message or a WhatsApp away, and he'll be more than happy to help you with whatever kind of treatment or solutions you're looking for. All right. So, even to the audience who's watching us live, if you have any questions with respect to dentistry or dental treatments or kind of even about your smiles, definitely you could post your question in the comment section, and Dr. Nishank would be happy to help you out on the same. All right. So, I think we will see some of the solutions.
Yeah.
Okay. So, these
This
are the
is implant
implants.
technology, ma'am. You can see implant over there. Here we are not disturbing any surrounding teeth. Without disturbing surrounding teeth, we are replacing the missed teeth with an implant.
Hmm.
Firstly we will place an implant over there. After getting healed, we will place a healing screw, and then we will place a crown over there. This all takes
Okay.
around 4 to 6 months of time, ma'am.
Okay, 4 to 6 months.
Yes, ma'am.
Okay.
Previously we used to take help of the surrounding teeth, and we used to build a bridge for replacing the missing teeth.
Okay. Mm-hmm.
Now we are
With the
using this
latest
implant technology for
advancements.
not to disturb the surrounding teeth.
Okay. Okay. Hmm.
Yes, ma'am. Here we can see four types of impacted teeth, ma'am. Mostly every almost all everyone will have impacted teeth, ma'am, because there will be, because of less space of jaw area, all the people for eighth teeth, they'll be having lack of space, so everyone will be, everyone's teeth will be placed in these kind of positions, ma'am. These are known as impacted teeth: horizontal impaction, vertical impaction. Here in last teeth you can see the angles of that impactions, ma'am. Even that impactions we will remove with the by, by guttering the bone, ma'am. We should cut the bone part to access,
Okay.
to get access of the teeth.
Okay.
So
Okay. So
even
that's
this we,
so that is a
so that
complicated process.
yes, ma'am. If you can see that last teeth, it is disturbing the surrounding teeth, ma'am. Even
Yes.
we will get damaged. Will get damaged for the surrounding teeth also with the problem of that impacted teeth, ma'am. So we will remove, and there is no need of replacing the eighth teeth. It
Okay.
is not useful, and it is not useful in aesthetics or mastication. So we
Okay.
will remove it, ma'am. That procedure is known as impaction or surgical extraction, ma'am. If teeth is
Impaction or
completely erupted,
surgical extraction.
if
Okay.
teeth is
Hmm.
completely erupted and decayed, then it will be extraction. If it is partially erupted and it is under the bone, it is known as impaction, ma'am. With with cutting the bone, we'll remove it, and we'll close it, ma'am. Next slide. This is root canal, ma'am. Here you can see three
Okay.
chambers of teeth, ma'am. One is enamel, the second is dentin, and third is pulp, ma'am.
Mm-hmm. Mm-hmm.
Here, here, if you zoom it, you can see all the three layers of the teeth, ma'am. First and second layers, if we get decay, we can remove the decay and we can place a cement over there, ma'am.
Mm-hmm. Mm-hmm.
If a decay enters into third layer like pulp, we cannot survive with that pain, ma'am. We cannot tolerate that pain, so there is a treatment called root canal for that. In that, we will save the tooth by removing that natural pulp, ma'am, and we will
Okay.
place some artificial material to give strength of the to give strength to that teeth, and we will
Okay.
close it, and we will replace that with a cap, ma'am. Here we will have our natural teeth with a artificial cap.
Okay. Okay.
Here we will not lose that teeth, and we will have same function, ma'am.
Okay.
Without extraction, we can save our teeth in initial stages.
Ha.
Yes,
Okay. So the durability, like the teeth will have a good long life no matter.
yes, ma'am. Yes, ma'am.
Yeah.
These are orthodontic treatments, ma'am. Here, if you see in first slide, it is a lingual brace. For lingual brace, some people will say to have braces openly. So for that kind of people, we will place a lingual brace because
Okay.
it will be inside the mouth, it other side of the mouth, so
Yeah. Other side of the teeth,
others
inner
cannot see
part of
that.
the teeth, behind the teeth.
Yes, inner part of the inner part of the teeth. And here next slide you can see metal brace. It is outer side of the teeth. It is
Hmm.
in silver color, ma'am. It is named as metal brace. In ceramic brace, it is tooth colored brace.
Hmm.
Some people feel shy to keep braces and come in front of the other people. So for that
Hmm.
kind of people, we suggest ceramic braces, ma'am. Ceramic braces means it is a tooth colored brace. If we come nearer to the person, we can observe that she or he is wearing a brace. From far distance, we cannot identify that they are wearing a braces.
Okay.
And
Okay.
other is clear brace. It is like invisible. Someone asked just now.
Hmm.
Yes, it is about orthodontic treatment. Here we can correct all the people, all the teeth who are having spaces are crowding over bite, deep bite, and even some people get speech corrections also with this.
Okay.
This is
Yeah.
about orthodontic treatment.
Hmm.
Here, orthodontist will treat that kind of cases, ma'am. And this is known as removable partial denture, ma'am. Complete denture. Sorry, for people who lose all the teeth and they cannot, for economically and for in all kind of ways they cannot go for implants. For that kind of people, we can choose this removable, complete denture. Here we'll take several impressions and we will make this denture, man. uh, it should be in our mouth for whole the day. While sleeping, we should keep it in a box and we should preserve it in a water, man. It is
Like old people and all
yes,
use
ma'am.
it,
Old
right?
people, yes, old people, because they cannot tolerate the pain and they cannot go to implant treatment, and they cannot maintain for 6 months. If we go for implants, we should have soft diet. For example, diabetic patient, they cannot have juices and they cannot maintain soft diet. So for that kind of people, uncontrolled diabetic people, we cannot go for implants. So in that cases, we should go for complete denture. It is only
Okay.
here we should remove it while sleeping, and remaining whole day we can wear it and we can eat and we can drink. All the functions are normal, man. Only thing we should
Okay.
remove while sleeping. That's all. This is a, removable partial denture, ma'am. You can see that ring. In that
Hmm.
patient, with the help of that only that teeth, we are building these many teeth. Here he will have all the remaining teeth artificially, and he can have all the function. Here we are choosing these because with the help of only two teeth, we cannot build all the dentures. So patients who are not willing to go to implants or who are not capable to go for implants, we can suggest these kind of treatment. Here it
Okay.
is uh, cost of this is also not that much as implants. It is very cheaper, man.
Okay. So this is another type of solution available
Yes, ma'am.
in
Removable
case
partial denture. It is named as removable
removable
partial.
partial denture. Okay.
Yes, ma'am.
Mhm.
Even this is the same thing.
Yeah, different structure maybe.
Here, patient is having anterior teeth and he is not having posterior teeth. So
Okay.
we are showing the slide of that teeth. Here we built only posterior teeth. Remaining
Okay.
natural teeth, he is having anterior. It is also same one.
Similar one. Yes.
Yes, ma'am.
So a lot of options available today to make yourself look beautiful and have a great smile. That is the first impression anybody could have, right? So we have few more comments coming in. Okay. Pradeep Kumar Garu, he's saying there is a lot of discussion with number of brushings per day as well type of toothpaste. What's your opinion, Doctor? Ani adugutunnaru.
Sir, only I suggest only if you have any type of sensitivity, then you should go for sensitivity paste, or else we can use other paste also. And I will post the brushing techniques in our group, ma'am. Now I cannot demonstrate, so that I will post the brushing techniques. If you follow that brushing techniques, we can save our teeth and we can maintain a oral hygiene good.
Awesome, Nishank. I think you could post it even in the Facebook comment section so that
Yes,
all our
ma'am. Yes,
audience
ma'am.
could
Sure, ma'am.
access and view
Yes,
it
ma'am.
later as well.
Yes, ma'am.
Yeah,
Brushing techniques and other appliances which can clean interdental surfaces also. I'll post all those things, ma'am.
very nice. Thank you so much, Nishank, for
Thank
that. And thanks for
thank you.
bringing up this question, Pradeep.
Thank you.
Shriram Gupta Garu, hello, BBB and tomorrow. Hello, sir. Thanks for joining in. He's from Vizag, Vishakhapatnam.
Ma'am.
Okay, Pavan Krishna Ellori Ramesh Garu. 2 years ago, I have removed both of the wisdom teeth of my left side. Now I slightly feel there is a gap between my teeth. Does teeth really make shift or gap after removing wisdom teeth? Ani adugutunnaru.
Sir, actually, if it is in anterior place or in between teeth, your doubt is exactly right. Wisdom teeth will not go backwards, sir. and there is no need of replacing wisdom teeth also. It's just your feeling. It might be a decay. You should observe that. You are saying that it is a space. Once you, if you see, you can, sometimes you can see decay also. With decay we will think that we are having some gap.
So he's telling he's got his wisdom teeth removed.
Yes, yes, I understood, ma'am. Sir's doubt is he removed 2 years back. Now
Yeah.
he's feeling some space over there.
Hmm.
Okay, it will not happen, sir. Your teeth will not shift to backwards.
Yeah. So I think Pavan Krishna Garu, I hope that answers your question. So he's telling that shouldn't be a problem, and
That is in
it is
case
not
of
like this.
wisdom teeth only, sir. That is in case of wisdom teeth only.
Mhm. Yes, so I hope that answers your question, Andy. So, to all the audience out there, for any kind of dental services or any kind of dental suggestions, if you want to ask, then our Dr. Nishank is always there. You could contact him.
Yes,
His contact number is 9030 666 189. Right. So, if any other questions or anything you want to um, ask or discuss, you could definitely post it in the comment section, or you could connect with our doctor a little later as well. So I was talking about other teeth. He's asking it is not about wisdom teeth, it is some other
yes, sir.
teeth.
In case of other teeth, if you have a missing teeth in between these two teeth, for suppose this teeth is missing here, this teeth will 1 second, sir. If you see in this, hello, sir. If
Yeah.
you see in this, if this teeth is missing, suppose canine is missing, here lateral incision and here first premolar, they both try to occupy the canine space. So here we should either we should replace with a permanent teeth or removable teeth, whatever it may be. It should not be empty space because surrounding teeth will shift their places. There you will find you will get some gaps in between the teeth, and you will face a lot of problems with that.
All right, so I hope that answers your question, Ramesh Karu. So yeah, I think we just got to know a lot of like little more details about what are the new advancements in dentistry, and what kind of treatments are available today to keep our oral hygiene and keep our teeth well and nice all the time, because as I said, that is the first thing that is going to impact when you meet someone, when you talk to someone. So it was really nice to interact with you, Nishank.
Thank you, ma'am. Thank you very much.
Anything else you would like to share with our audience?
Nothing, ma'am. Feel free to call me at any time for any kind of dental problems. I'm here to help you.
Yes, so Nishank, from when is Nishank with WeVysya?
Ma'am, since 6 months, ma'am.
6 months. So how is your
Yes, ma'am.
journey with WeVysya?
Very well, ma'am. Rocking. Here, here, I got interaction with all kind of people, all kind of fields, and here we are gaining much knowledge, where we can find all groups together and we'll have discussion for every 10, 15 days. We are having one meeting, so it will be nice to meet all the people and share their thoughts with us and our thoughts with them. It helps us a lot, not only in our field. It will help to build our relation with others also.
Yes, absolutely. Rightly said. Thank you so much for that. So how are you feeling being part of this show today?
Very, ma'am, very pleasure and very nice, ma'am.
Very nice, Nishank. It's really a pleasure also to have you on this show today. So I wish you all the very best for you to grow to greater heights in your stream of interest, and
Thank you, ma'am. Thank you
may you
very
treat
much.
more patients, make them smile to a greater extent in an awesome way, and let them all be happy about it.
Thank you very much, ma'am. Thank you very much, ma'am.
Okay, Nishank. Thank you so much for joining in. Good
Okay,
night.
ma'am. Thank you, ma'am.
Yeah. All right, so today in the 110th episode of Business Bites with Bhavana, we just spoke to Dr. Nishank, who's into dentistry. So I see Pavan Krishna Garu is asking more questions. Sir, I think we just closed it. So you could just, the Nishank's number is in the scrolling window. You could just make a note and connect with him. He will definitely be able to clarify all your doubts and the. So feel free to connect with him. His number is 9030 666 189. All right. So if you are an Arya Vaishya and still not part of a WeVysya family, I think now is the time. You could visit www.wevisya.org, or you could reach out to us on 9886 128 128. This is the contact number. So we will be more than happy to welcome you with open hearts and open hands. Right. So before we end the episode today, as usual, thought for the day: do what is right, not what is easy. Right? Do what is right, not what is easy. So at any point of time, follow the ethics, values, and do what is right and not what is easy or what is accessible at the moment. While I say this, think about it and go to your bed and have a great evening. Good night to everyone. I'll catch up again tomorrow with another member and another business that we're going to talk about. Till then, take care, and signing off, yours, Bhavna.